Now let's talk a little bit about what collaborative or peer-assisted learning means to us in physical therapy clinical education. In clinical education, collaborative learning means more than simply having two students working together under the supervision of a single clinical instructor. It means engaging those students in meaningful learning activities with each other in the clinical setting. You'll hear a lot of different terms associated with it, like the ones shown on this slide, but all of these terms share a common theme, and that is students learning together through collaboration. Before we go any further, take a moment to consider the possible ways that using collaborative learning with your students could positively affect your own experiences as a clinical instructor. Ask yourself, how might I use a collaborative model to reduce my teaching burden as a CI? Pause the presentation while you consider this question, and then look for further answers and ideas as you continue. Later, in a discussion post, you'll share these ideas and collaborate with your classmates on ways to use collaborative learning to enhance your experience with mentoring students. Putting collaborative learning into practice is often met with some skepticism because we anticipate challenges with having two students at the same time. Let's take a look at the literature to see if any of these challenges have merit. First, it seems like a 2-to-1 model would mean more work for us as a CI. Let's see what the literature tells us about this. Certainly, the CI will have a greater administrative burden because they'll have to complete a performance assessment on 2 students instead of 1. However, several studies have found that CIs actually report less of a teaching burden and decreased stress and workload when they have 2 students versus 1. This is because the students rely on each other as a resource before approaching the clinical instructor, and they can perform much of the CI's patient care and documentation tasks. This ends up giving the CI more time and less stress than when they have only 1 student. Another common perception about 2-to-1 models is that productivity will suffer if we have too many students. However, this perception doesn't seem to be supported in the literature. Several researchers have explored this issue in both inpatient and outpatient settings, and they've found that productivity is either unaffected or even improved by having 2 students at the same time. So, if you try collaborative learning, you just might boost your productivity. It also seems logical that with 2 students sharing one CI's workload, there will be a lot more downtime to fill. Well, this perception is certainly borne out in the literature. Several authors have reported that students and CIs feel that the patient caseload sometimes drops to a level that doesn't allow both students to stay busy with patient care. However, they also point out that this doesn't have to be a negative experience. Remember how mirror neurons work? Well, we can learn and mentally practice a skill by simply observing someone else doing that skill. So we can put those mirror neurons to use by having students take turns treating patients and observing. And what about when cancellations happen? This can actually be easier with 2 students because you can have them complete collaborative projects together, such as case reports, patient rounds, documentation reviews, peer feedback and assessment sessions, or preparing an in-service together. This is much more productive with 2 students than it is with 1. Most authors seem to agree that in a collaborative model, students don't get quite as much one-on-one time with the clinical instructor. However, one-on-one time may not be as crucial as we think it is. In fact, several authors have found that students in collaborative models actually learn their clinical skills faster than they do in a one-to-one model. So one-to-one supervision doesn't seem to be as necessary for successful clinical instruction as once we thought. Additionally, as long as you make sure that the students are giving each other regular constructive feedback, they end up actually getting more feedback than they would in a one-to-one model. And students in a 2-to-1 model report less anxiety, more self-confidence, and more independence than their counterparts in a one-to-one model. So the benefits seem to outweigh the perceived cost of reduced one-on-one supervision. Now we'll wrap up with a short discussion on the challenges and benefits of collaborative learning models. Several studies have found that competition might develop between the students, and this could be positively motivating, or it could be a more unhealthy, negative competition. These studies suggest that unhealthy competition can be avoided by properly matching students with similar academic performance and backgrounds. So, if you agree to take 2 students, be sure to communicate with the school regarding the matching of the students. Other authors have mentioned that physical constraints can be a barrier. This challenge is related to the scarcity of physical resources, such as having enough space in the treatment room for 3 people, or having enough computers and desk space for both students to do their documentation. As with other challenges that we've discussed, this can usually be resolved with a little planning and sharing of space and resources. We've already discussed the last 2 challenges listed here and how to resolve them, so let's move on to the benefits of collaborative learning. As we've already suggested, there are a lot of benefits to using collaborative learning in clinical education. Many clinical instructors report that their workload actually decreases by having 2 students instead of 1, and that learning outcomes such as communication skills and speed of learning are improved in a 2-to-1 model. And a lot of studies have also shown that students have a more positive experience because of the peer support, safer learning environment, and enhanced feedback. We want to highlight 2 recommendations from the literature for anyone using a collaborative learning model in clinical education. First, take a positive, solution-oriented approach. If you see a potential challenge, first ask how you might turn it into an advantage. If that's not possible, ask how you might minimize the effects of that challenge. The evidence shows that this pragmatic, positive thinking approach is the best way to ensure successful outcomes. The second recommendation is to do exactly what you're doing. Get trained in how to use collaborative learning. So nice work! And that wraps up our discussion on the benefits and challenges of collaborative learning. If you'd like to delve deeper into this topic, please take a look at the references listed at the end of this presentation. Thanks for listening. Be sure to complete the discussion post for this module to help you solidify what you've just learned and apply it in your own practice. Here are the references for the information we just shared. There are a lot of them, so they're on 3 different slides.